So I'll knock on my patient's door, I'll enter, I do my hand hygiene. Hello, how are you doing? My name's Claudia. I'm gonna be your student nurse for today. And for this week's assessment, we're going over the musculoskeletal system. So first, I'm gonna start off by asking a few questions. Have you ever had any problems with your joints, any stiffness, any pain?
No.
No? Have you had any problems with your muscles, like weakness or cramping?
No.
No, okay. So the first part of our assessment, we're going to take a look at our temporomandibular joint. And throughout the whole assessment, I'm going to be palpating for any masses, anything abnormal. I'm going to be inspecting for any redness, any inflammation, any deformations. And then I'm also going to be, so for the temporomandibular joint here, I'm going to ask my patient to open and close her mouth. And I'm inspecting and palpating for any clicks and crepitus, and I don't feel any. So I'm going to ask the patient to also bring her jaw forward and back and side to side. So her range of motion is normal. So after that, I'm going to check her cervical spine back here. So if you could just turn. And I'm going to be taking a look at the spinal process back here. So just look down. I'm inspecting and palpating here. I'm just looking for anything abnormal, any masses, any inflammation or redness, but the cervical spine or the spinal process is nice and straight. So turn back around, please. And now we're going to be checking our range of motion. So look up, just with your head, look down, side to side. And then with your ear, bend down to your shoulder, your other ear. Perfect. And then now we're going to be checking for the strength. So just push against my hand with like this. Turn against, okay? And turn against. So strength is good. It's nice and normal. So after that, we're going to our shoulders. We're inspecting and palpating anterior and posterior shoulders. We're looking for any masses, any tenderness, redness, swelling. I am also going to stand up, please. I'm going to be checking the range of motion. So take your hands from your sides and go up above your head. Okay, and then back down. And then you can look at me. Take your hands forward above your head and back down. And now back. We're just checking the motion. That's good. So range of motion is good. It's normal. I'm also going to be checking strength, so you can come a little closer. I'm going to push down on your shoulders and you push up. Okay, strength is nice and normal. So go ahead, sit back down. Now we're going to the elbows. So we're inspecting and palpating, cold fingers. We're inspecting and palpating the elbows. We're looking for anything abnormal, any tenderness, any masses, redness, but it's nice and normal, nothing abnormal. After that, we are going to check our range of motion. So take your arms, go straight out like this, curl up, back down, straighten them out. And then I'm going to check, and also rotate like this. Perfect. And then I'm going to check your strength. So curl, and I'm going to pull, perfect, and push, perfect. So strength and range of motion are normal. After that, after elbows, I'm going to be checking our hands and fingers and our wrists. So I'm going to palpate all over our hands because we have a lot of bones and joints here, so I want to make sure there's no tenderness, no swelling, no redness, no masses. I want to make sure it's nothing stiff. Okay, so after that, we're going to check range of motion. So go ahead, have your hands out, down, up, and then up, fingers out, together, and then put them straight out again. And now only your fingers down and up. And now put them out like this, and I'm gonna check your finger strength. Perfect. So strength and range of motion are normal. After that, I'm gonna check hips. So go ahead, get your legs up. Perfect, so you can lean back. So for hips, we're just palpating for any tenderness or masses, but everything seems normal. So now we're gonna check range of motion. I'm gonna have you take this leg and keep it up, but swing it out this way. Now bring it back. Now lift it up, down, bend your knee, and bring your knee to your chest. Now bring your knee in, like this, out. Okay, now back down, so that's perfect. Now same thing with this one, we're gonna bring it out, in, up, down, bend the knee to your chest, in, out, back down. Now we're gonna check for the strength. So with both your legs, push out against my hands, perfect. And now in, push in, perfect. Strength and range of motion are perfect. So after that, I can check the knees, so scoot back a little bit more. So here we're palpating and inspecting the knees. Do you have any pain here?
No.
No? Okay. So again, we're inspecting and palpating for anything abnormal, redness, tenderness, masses. So now we're gonna check range of motion. Just lift your legs up. Oh, just your knees.
Mm-hmm.
Just like this.
Oh.
Okay, now the other one, perfect. And now we're gonna check strength. So just push against my legs, perfect. Or my hands, but that's good. So strength and range of motion are good. After knees, we're gonna go to feet. So go ahead and lift up the feet. Okay, so now we're going to palpate and inspect our feet and ankles. So again, we're inspecting and palpating all the joints and all the bones here. We're looking for any tenderness, redness, any swelling, any stiffness. No. Okay, so after that, I'm gonna check range of motion. So with your toes, touch your toes like this. Touch your toes together and apart. Hold on, like this. Together, apart. And now with the bottom of your feet, touch them together and like that. The other way, face them the separate way.
Okay.
Like that, out. Okay, perfect. And now we're gonna test strength. So push up and push down. All right, and strength and range of motion are good. So for our last one, we're gonna check our spine. So here I'm just gonna lift up the shirt, bend over a little bit. And here I'm just palpating, inspecting all down the spine for anything abnormal, any lumps, bumps, tenderness, warmth. And then if we're also bending down, we want to make sure that our spine has a nice C shape. So everything here is nice and symmetrical. And stand back up if we want to make sure that our back is symmetrical. We make sure we're looking at shoulders, scapula, our gluteal folds, and our hips. So everything's symmetrical. And then we're also gonna check range of motion and strength. So put your hands by your hips, go side to side, Okay, and then, so I want you to turn without turning your hips from side to side. Perfect. So, oh, and we're not checking strength there. So that concludes our musculoskeletal assessment. Thank you.
Thank you.